My name is Kathleen Bell, and I'm a singer, voice teacher, and DMA candidate in voice pedagogy at Shenandoah University. And today I will be sharing with you the results of a survey of the incidence and treatment of singers with diagnosed laryngopharyngeal reflux, or LPR, and gastroesophageal reflux disease, or GERD. I was diagnosed with LPR when I was 21. But it seems that as many as 20 to 40% of the population might suffer from this malady. ENTs have suggested that even up to 70% of their patients have this condition, at least as a comorbid situation. But as a singer, of course, I'm going to be more concerned with the voice-related symptoms, such as hoarseness, longer voice warm-up time, a persistent cough, and just basically an inability to sing like I normally have. Many of these voice symptoms persist even after successful medical treatment. So I decided to look at if this was a situation for most singers. Is LPR and GERD more prevalent among singers? And if so, are singers aware of how to treat LPR and GERD? And what is the difference between the two? What effect has LPR and or GERD had on their careers? I generated a survey with SurveyMonkey, and then it was distributed through social media vis-a-vis NATS, College Music Society, Music Teachers National Association, and Facebook. I collected demographic data such as their age, their BMI, what kind of vocal load they had, what kind of music that they sang. Then I also explored their medical diagnosis. Was it from an ENT? Was it from a gastroenterologist? Did they have any comorbid conditions? Did they have vocal pathologies? We also explored their personal treatment strategies, whether it was dietary or lifestyle changes, medical treatments, or perhaps even surgery. And then lastly, how did reflux affect their singing career? 440 people responded to the survey. As you can see, the age distribution was relatively normal. Of course, there were more females than males, as is often the case. And these singers represented various styles of singing and vocal load, anywhere from less than 30 minutes a day to several hours a day. Many of the people had been diagnosed over 5 years ago. However, only 359 had actual medical diagnoses. As you can see by the numbers, many of them were diagnosed with both GERD and LPR, and on some occasions had hiatal hernia and Barrett's esophagus. In this population, there were no incidences of cancer. Most of them were diagnosed by ENTs and laryngologists, but an equal number were diagnosed by either a gastroenterologist or their primary healthcare physician. It was interesting to note that 87 did also have asthma, but I was surprised that there were not more vocal pathologies associated with LPR. In fact, I was very interested to see that there were only 8 incidences of vocal fold paresis and just 21 vocal hemorrhage. They did express a lot of voice complaints. The most common, of course, was the postnasal drip. But I found it very interesting that there were about 50% of them that experienced vocal fatigue, basically not able to sing for quite as long as they usually could. They also experienced prolonged warm-up time and, not surprisingly, the inability to produce soft sounds and some reduced pitch range. All of these things extremely difficult for a professional singer. I was surprised at the lack of dietary changes. Just over half of them admitted to cutting back on acidic foods, but a mere 20 people gave up alcohol, and it's very interesting to see not many more than that ceased drinking caffeine. There were also numerous lifestyle changes, mostly in response to their dietary intake and also waiting 3 hours before going to sleep. It was interesting to note that right around 50 had either purchased the Medcline wedge pillow or raised their bed. Not surprisingly, 300 of them reported that they were using PPIs. What was interesting is that 124 of them said that they had been taking these PPIs for over 5 years. Only 17 had surgery, which was actually kind of surprising considering how many people had suffered for multiple years from LPR and GERD. Not surprisingly, it was Nissen fundoplication, which was the most common one, although, as you can see, not that common. It was also very interesting to look at the different alternative therapies that they employed. I was very surprised that 80 people admitted to drinking apple cider vinegar as a treatment. 55 also said that they drank high pH water. However, it wasn't within the scope of the survey to suggest whether or not it was successful. It was interesting to note that about 90% of them expressed that it at least somewhat affected their career, and about 7% said it effectively ended it. When asked if they had friends that also suffered from GERD or LPR, almost 80% expressed that they knew at least one person, but close to 20% of the respondents seemed to think that almost everyone they knew suffered from GERD or LPR. So what does this all mean? It's very interesting to see that 40% were significantly affected by LPR or GERD, and 8% virtually ending their career. And it seemed like so many people were suffering in my survey. But there is also a little bit of confusion over diagnosis and what is the best way to treat. Many of them had taken everything, had followed all the advice, had changed their lifestyle, had changed the way they dressed, had stopped eating different kinds of things, but yet still did not find relief. So many of them just gave up. In conclusion, there's just a limitation that it is just a survey, and a survey that was distributed in singers' organizations and musician organizations. So therefore, those who would have filled it out most likely were interested in LPR or GERD. It would be interesting to see just a broader survey. I would like to analyze further whether or not age affected their perception of how it affected their careers, or their weight affected their perception, or even their training or lack thereof. But the take-home message is to please keep doing research on LPR because we need you. So many of the singers are really frustrated with the options and the choices that are out there. And as maybe Tom Carroll has suggested, do they even have reflux at all? Thank you so much for your attention to this presentation. Especially I'd like to thank Dr. David Meyer, my committee on my dissertation, and also all of the faculty at Shenandoah University. Thank you again, Maria and Dr. Sadaloff, for providing this opportunity to present online in this situation, and I pray that next year we will all be together and celebrate again.